Very good evening, friends. We have finished big chapter from H.A.Robert's philosophy. That is the role of homeopathic therapeutics in the field of endocrinology. His own study of homeopathy in relation with endocrinology and how to approach with endocrinal hyperfunctions, hypofunctions, endocrinal syndromes, and how one should go and prescribe the approaches he has tried his level best to explain. The aim The inference is that the way you treat any chronic disorder in the similar manner, you can treat the endocrinal disorder. And this is what he has explained with the help of examples of some of the endocrinal problems. At the same time, explaining the role of constitutional remedy in many endocrinal disorders. And that aspect he has tried to impose on your mind, because of which it becomes rather fixed that there is nothing like for hypothyroid, the thyroidinum, or hyperthyroid, the hypothyroidinum. It's not like that. It is not a homeopathy. Unless and until we get a perfect simillimum on the basis of totality of symptoms, on the basis of constitutional symptoms, constitution, and miasmatic background, we have to reach to the way we can find it out a remedy. Otherwise, it is not possible. So after finishing that, we have to enter into one more very important topic in which Robert has tried to correlate homeopathy with the science, the scientific aspect of homeopathy. And that's why the name which he has given for this chapter is the phenomenological point of view. So open your Robert's book, chapter number 33, the phenomenological point of view or viewpoint. In his introduction to his book, Philosophy and the Concepts of Modern Science, 1935, Oliver L. Reiser, Associate Professor of Philosophy, University of Pittsburgh, tells us that one possible method of integrating the vast and unwieldy masses of the facts of the sciences into meaningful wholes, the adoption of phenomenological point of view is recommended. By phenomenology is meant a study that which exhibits or displays itself. It is the descriptive point of view obtained by viewing the things as a whole. Much of the trouble comes from overemphasis upon the microscopic details. Thus, it comes from that we can no longer see the forest for the trees. So he is explaining over here. This is the Roberts method that he takes the help of some of the books, journals, and from their views, he tries to explain what he wants to say. And here he takes the help of the book from the Oliver Reiser. And what he has said is very correct. You have to correlate the modern science in relation with the concepts of dynamics, the homeopathy, what science says and how it is correlated with the with modern science. That if you are able to show to the world, to the people, then they will understand the phenomena of the homeopathy, because it will be in their language. How homeopathic remedy works and why it works, why this energy develops, and what is the correlation of energy. If you talk in sense of energy, then the people understand, because scientific people always talks in the form of energies. But if you say just talking about the dynamic things, then it becomes rather difficult for the others to understand. And this correlation, he has tried his level best to explain to the people. At the same time, he is explaining that using the microscope, we are limiting our understanding about the whole. It is not possible to understand whole human being. When you use your microscope, you can reach maximum up to the atom. More strong microscope, you can get a structure of atom, but not beyond that. But energy lies in the center, in the nucleus of an atom, which is invisible, and you cannot enter into the invisible things. And those are dynamics. Homeopathy thinks about that. Homeopathy considers this energy of atom which lies inside it and how to release it, what are the different ways with which it can be released and used for the better mankind. That aspect, one if one talks with sense and if one talks with the scientific sense, then people will understand. This correlation here he tries to explain over there in this chapter. And that's why he is taking the help of different peoples. One of the really great discoveries of recent times is what has been termed the principle of uniformitarianism by the geologist. That is the theory that the forces now at work are identical in nature with those that produces changes in the past ages. And this is the principle which works everywhere. One important thing even Stuart Close has said, that is, if your principle is scientific, it must go hand in hand with the principle of natures. There should not be a disparity. The one principle should be in correlation with the other principle, then it is called as natural. That's why our nature's law of cure has given a name nature's, because it happens, the phenomena happens in nature everywhere, and you're going to find it out the same thing everywhere. Whether it is related with the sound, whether it is related with the light, any dynamic thing, the same law is applicable. And that's why it is called as nature's law of cure. And this law goes hand in hand with the laws of physics, laws of biology, laws of chemistry. And that's why one chapter given in Stuart Close, the second chapter, where he tries to correlate all those laws, general interpretation is the chapter in Stuart Close. The same thing here, Robert tries to explain that this correlation is so much necessary. If we take this phenomenological view of the science today, we cannot help but see the reader's comment on the overemphasis upon microscopic details as being the source of multiplied data and chaotic theories of cause, action, and effect is all too true. The strain of application to the microscope has produced a mental and philosophical astigmatism that permits each part to attain disproportionate focus in the whole. Modern science is relating the things only with a microscope, and they reach up to where it is visible. Beyond that, they cannot think. And because of which they cannot take into consideration the dynamic mind. They cannot take into consideration the dynamic energies. And then there is always a problem in explaining many things, and then they use just one word. If they are not able to explain, they called it metaphysical. Instead of physical, they called it metaphysical. And if we understand this metaphysical and we explain that these metaphysicals are nothing but the dynamics and how it works, and explain it to the world, then people will understand this homeopathy is more scientific than any other pathy. It never believes only on the microscopic findings. If there is any change in the cell structure, whether it is anaplasia, whether it is dysplasia, whether it is hyperplasia, whether it is hypertrophy, whatever it may be, science, modern science tells us that you are having problem because of these changes in cells. Actually, they are the end products. They are not the causes of the disease, but it has been explained by deception to the people that you are diseased because your cells have changed. But there is no answer why those changes are there in the cells. Why it becomes dysplastic? Why it becomes anaplastic? Why it becomes hyperplastic? You cannot find it out, and that's why it becomes rather difficult. So these microscopic theories will reach you or will take you up to certain level, but they cannot explain causes of the things which remains hidden. Medicine, in particular, needs to view the whole to take into consideration the principle of uniformitarianism. So far, As has been acknowledged by eminent authorities in the dominant school, homeopathy alone has offered such unified theory that embraces the cause of disease condition, the course of conditions, and its prognosis. And at the same time, the method of approach of to the remedial agent and the prognosis of its action upon uh, prognosis of its action upon the patient based upon knowledge of the patient, the knowledge of the remedy, and the comprehension of the laws and their expressions in varying states of health and disease. See, this is the only pathy in which you are able to explain the causes of diseases. It is the only pathy which goes beyond the structure. It is the only pathy which takes into consideration the dynamics of the human being. And that's why we know the causes behind the diseases. We know the pathogenesis of the diseases. We know the totality of the symptoms. And we give importance not only to the objective symptoms, but we give so much of importance to the subjectives which individualizes the patient. We used to use the investigations to understand the disease, but prescription never depends upon that. And then, on the basis of all those things, we know what may be the prognosis in that patient and how one must approach. The thought should be very clear in your mind. And this thought, clarity of thought develops once you are having a very typical scientific aspects. Homeopathy is the medical science which is based upon 7 cardinal principles. There is no science which is based upon such a cardinal principles. It depends upon opinions. Modern sciences depend upon opinions. Modern science is based upon experience, but there is no fixed foundation. Here there is fixed foundation. That's why the approach is very clear. We have to deal with the patient. We have to take into consideration each and every detail, the case taking. We have to understand the chief complaints along with the associated complaints. We have to take into consideration to find it out miasm, the past history and family history of the patient. Then we have to understand that person as a whole, and that's why we give so much of importance to the personal history. Then we opens the lock of the mind and find it out how the person is at the mental and emotional level. After this whole story, we get something. Then we get something from attendance. Then we get something from the investigations. And then we come to the conclusion of a diagnosis. But that diagnosis never gives a remedy. We finds it out the totality of the symptoms. Out of that totality, we go for repertorial totality. Whatever remaining symptoms are there, we keep it in potential differential field. After repertorization, the first 4 5 remedies we compare with the help of potential differential field, or ultimate course court is materia medica. And then we reach to certain remedy. Then again we reach to the organon, judges the susceptibility, finding it out what is the patient's pathology, what is patient's constitution, what is patient's mathematic background, in order to reach to the right potency and right repetition. And then we prescribe. Very clear scientific foundation is there, because the method is very clear. Whether the patient is having cancer, whether the patient is having endocrinal problem, whether the patient is having asthma, whether the patient is having heart disease, this method never changes in chronic diseases. And this scientific foundation is there because we have 7 cardinal principles. The law of similars, the law of simplex, the law of minimum dose, the doctrine of vital force, the doctrine of drug proving, doctrine of drug dynamization, and the doctrine of chronic diseases. Very clear scientific foundation. At the same time, we can predict the prognosis on the basis of Helling's law of direction of cure. So if such a foundation is ready, it means homeopathy is a phenomenological point of view. It expresses whole phenomena. It makes it clear, so clear to the people, and there is no question of opinion comes at that time. The question of scientific foundation comes, and here the homeopathy reigns over the rest of the systems. This is another way of saying that homeopathic concept of disease and cure is from phenomenological viewpoint, in that it considers the broad outlines of the whole rather than some of the minute divisions compassed by the microscopic vision at the same time embraces the meaning of which the microscopic vision demonstrates but a part. So homeopathy considers individual as a whole, taking into consideration his physics, his microscopic details, but those are insufficient to differentiate one individual from another individual. Here, you have to take into consideration the dynamics, the mind of the human being, the emotional state of the human being, the logic of the human being, the susceptibility of the human being, all things we used to take into consideration when dealing with any chronic disease. And if it is so, then and then we can reach to a remedy. So this is very clear understanding, taking into consideration the whole of the human being instead of concentrating on few points or only one part of it. And this is a differentiating factor. And this is phenomenological viewpoint of homeopathy. This is how homeopathy explains the human being and his disease as a whole, which other pathies never. We'll take simple example of today. I had a patient, she's a doctor, she was BMS and she came. She was just young, 20, 24, 25 years of age. And she had just 1 month back, she was diagnosed as a nephrotic syndrome. Why this nephrotic syndrome? They have done n number of tests and they reached to that there is a proteinuria, then microalbumin is raised, and then all those things, and she's having edema over lower extremities, marked edema. She's not actually having a normal weight, everything is fine, and all of a sudden, why it has developed? The answer is not there. They either explain that it is idiopathic, they either explain it might be autoimmune. They have they have done the ANA test. N is positive, they explain autoimmune. But why this autoimmunity? 1 month back, she was absolutely healthy, and why it has changed? Why a order goes into a disorder? The answer is not there. When I took the case, there are many factors, but one factor was that she was using for her face a solution, a cream, which contains high degree of mercurius. And they also said that this is mercury inside the body. They checked and mercury increased in body. It gets absorbed. At the same time, she had an eczema on her left leg, and which was suppressed with the help of clobetasol. See how the things are turned into a disorder just because of manifestations getting suppressed and going from less important organ to more important organ. We understand from homeopathic point of view that why this disease has developed, which was not there earlier. Even family history, there is no nephrotic syndrome, there is no such problem. And why she only suffers is the reason is that she has utilized such local applications, which in turn turned the disorder into a very vital organ. It is our duty to bring back again into the surface. It is our duty to explain to the patient, this is the prognosis. If your skin symptoms returns again after starting the medicine, then definitely you're going to get recovered from that. And this is how it develops, because we know the prognosis, because we know the cause of the disease. We are able to go beyond the limit. And this is what happens with homeopathy. This never happens in modern science. And that's why we are able to reach to the right remedy. We are able to cure chronic diseases because we have a scientific approach, to which he labeled by the name of phenomenological approach. So this is very important thing which he is explaining over there. This chapter is a chapter where you'll find many examples and many correlations of scientificity of homeopathy. And he explains, taking the help of Millikan's references, how the fine, how what happens when you reduce the doses in the medicine and how energy is produced. Everything he has explained over there in this chapter. So this is a wonderful chapter to understand the scientificity of the homeopathy. It is better to stop over here, and tomorrow we'll continue with the same. So thank you being there. We'll meet tomorrow at the same time. Yes, Dr. Vanishka, very important. I forgot, but yes, sepia is it is nothing but the ink which has a typical color, and it used to produce a color to the body. Generally, when there is an animal charcoal, when bones of animals are taken into consideration, it used to produce the black color. The sepia used to produce a ink-like color. It is dark blue to black. And that's why it has a very close relationship with the same thing, the animal charcoal and the sepia's ink. And that's why it is called as a, this remedy is labeled as a animal charcoal. So this is the same thing is there, which happens to be there, and that's why it has been labeled over there. So second important thing, this is the question for MCQs in PG NEET. So must know that this remedy is called to be a animal charcoal, sepia. Okay. So thank you, and we'll meet tomorrow at the same time. Good evening.
Thank you. Thank you, sir. Have a good evening.